Following Venezuela's catastrophic dual earthquakes, international aid groups are racing to prevent another health disaster. With over 3,000 dead and thousands more left homeless, doctors are pivoting from trauma care to managing widespread outbreaks of respiratory infections, dehydration, and chronic disease. The dire situation has also pushed Venezuela's already collapsed public health care system past its breaking point, leaving displaced families reliant on field clinics and volunteers to source life-saving medications. Here to tell us more is Rafael Velazquez Garcia, the emergency response lead for the International Rescue Committee. Thank you so much for coming on today.
Thank you for having me.
What are you witnessing firsthand on the ground, and what are the most critical medical needs?
So our organization responds to situations like this all over the world. And one of the things that got my attention is beyond the numbers. We now have more than 3,600 recognized casualty. We have 60,000 people who have been directly affected by this. We have right now more than 30,000 people. Is the vulnerability amplifiers. As it was mentioned early on, the fact that this was already a health system that was stretched then, the fact that we have an aged population with a mass migration that took place over the last years, about 7 million people left the country. This yesterday morning, I was talking to our local partners that are providing health services, either first aid services or primary care, and they were telling us that they're concerned because it's not only the lacerations and the first aid from people who were hurt during the earthquake, it's also the fact that many of the people who were already in condition of vulnerability, who may have had people with diabetes, chronic conditions, people who needed to access nebulizers for respiratory issues, are no longer able to access those in clinics and hospitals. And that's why it's incredibly important, these mobile health systems that we have, mobile service units that move towards the community, many communities that have received people that have been displaced from the earthquake.
As we've highlighted, Venezuela's public healthcare system was already facing massive shortages before the earthquakes. How is it compounding the current crisis?
So this is a very important question because people forget that in Venezuela, we had a humanitarian response plan that was trying to reach 7.9 million people. Due to funding shortages, that target was moved down to 5 million people of the most vulnerable. But the current calculations indicate that now it's going to go up in terms of people with humanitarian needs by more than 1.4 million people with need of assistance. So it's a massive increase. And of course, rightly so, the focus has been on search and rescue operations. But now, as we start looking at early recovery, it is incredibly important to look at rebuilding, providing people with that level of agency so they can recover their livelihoods. And that's not going to happen in 2 or 3 weeks or 4 weeks. That's going to take months, maybe years.
This is definitely a long haul ahead for our viewers. Can you explain some of the other obstacles the relief workers are encountering on the ground?
I would say number one is the sheer size of the damage. We've driven through this area, blocks after blocks after blocks of completely destroyed, flattened buildings. Even today, I was getting a sitrep from a situational report from our team on the ground. And as they're leaving a monitoring visit, they were telling us that the doctors that were working with us were called on because it seems that there are 16 people trapped still in the rubble 2 weeks after the earthquake, and they're trying to provide services as people may be able to be pulled out. Also, the history in terms of being able to help these people, we were just in another site where there is if I can share an anecdote, there is a beautiful park. Next to the park, there's a church that has been completely flattened. And next to that church that was flattened, there was a little clinic that was run by nuns that are one of our partners that we're working with and supporting. As I was looking at that, the nuns have lost their clinic, they've lost their church, and what they're proceeding to do what they've been doing for the last week is pulling the medicine out of the hospital and helping people in the park. So there's absolutely nothing that will stop these people from helping each other if they're given the resources to do so.
A makeshift clinic in the face of such adversity. Now, you have been doing this for a long time. You've traveled to places around the world. How does this compare to other events you've seen?
It's massive. I've responded to Hurricane Otis in Mexico. I've responded to the Beirut blast in Lebanon. Here, you can drive for 10 minutes and don't stop seeing the level of destruction. There's no question that the resources do not meet the level of destruction that we're seeing on the ground. So it is important to remember we're talking about 2 earthquakes. And, talking to our team, people who were affected by this earthquake, That lasted for more than 40 seconds. I am not surprised to see, unfortunately, so many buildings, so many houses, hospitals, schools, and lives destroyed.
The global community has already responded, and of course, hopefully they continue to do so. Rafael Velazquez Garcia, thank you so much for your work and for joining us.
Thank you.